talk about low back pain. Okay, so, majority of us chiropractors out there, that's pretty much our prime, bread and butter is low back pain. But we're going to look at it a little differently now because we're going to address it in terms of how it relates to sport, in terms of the activities that you might be doing. So before I get started, as always, thank you to everyone who has already subscribed to the channel. And if you haven't subscribed yet, please go ahead and hit that subscribe button that you do see down there. And then if you find that there's certain types of videos that you like, please hit the like button as always. And if there's certain things that you want to kind of hear more about, in terms of specific types of conditions, you would like some further advancement on some stretches, exercises, things that you can do to stay pain-free, always drop comments down below. I'm here to help, and I want to see that everybody does get what they want out of the channel, because the channel is designed for you, and it's designed to help you stay pain-free, as we especially go into 2021. All right, so like I said, we're talking about low back pain, and as always, I have my friend Mr. Super Skeleton here, because we just want to address kind of what the anatomy is, around our low back, because it can be some various different types of conditions that can arise that can give us some low back trouble. So if we take a look at our low back right here, we're looking at our lumbar spine. Our lumbar spine is made up of 5 vertebrae. So a lot of times where that 12th rib comes off, that's our thoracic spine, number 12. Then we would have lumbar 1, 2, 3, 4, 5. And then from there sits our sacrum, and then our coccyx bone off to the end. Also, too, when we talk about low back pain, a lot of people are familiar with the word with sciatica pain. Some people are more familiar with sacroiliitis, which is actually where the sacrum and the ilium meet, and it's creating some rubbing, friction, and creating an itis. And as I've said before, itis always does mean inflammation. And when we're talking about the sciatica nerve getting irritated, creating low back pain, that's usually more at the nerve root level, coming off of lumbar 5, S1 kind of area, and then it's coming down, the leg there. So when we look at low back pain and how to really address those things, the first thing we really want to start addressing is if we're in the acute phase, if we're in that first 72 hours, we really do want to focus on just icing, resting, taking that anti-inflammatory as long as it doesn't interfere with anything else that you are taking. So please make sure you do check with your primary care physician if you're also your pharmacist as well. But you do want to kind of go ahead, and in that initial phase, you do not want to start doing any of the soft tissue work or the stretching, because it could make the pain symptoms a lot higher. So in that initial 72 hours, when it's really acute, you do want to rest it, you want to ice it, and when you ice it, you do want to look at doing ice 20 minutes on, 20 minutes off, very important there, and really just kind of babying it a little bit. And then once that 72 hours kind of has passed, you can look at doing some various types of soft tissue work, which is what we're going to go through today. So today we're going to look at using a massage ball to the QL, which I've mentioned in other videos. Then we're going to look at using the foam roller to our low back, to our SI joint, but we're also going to adjust our piriformis muscle as well, because of how it sits here and attaches itself from the sacrum down pretty much towards that greater trochanter, which sits off the femur. We want to make sure that the piriformis isn't also contributing to any nerve root irritation as well. So we're going to look at those things right there. The final bit that we are going to look at doing is when looking at low back pain, we really want to start strengthening our spinal stabilizers. And those are the little guys that really come off the spine. They come off the facet syndrome, the facets in the lumbar spine. So we want to look at all those things there. We really want to start strengthening the spinal stabilizers. When we look at strengthening spinal stabilizers, just so you know, we are referring to our core, which is our deep abdominal musculature. So, if you've just had a baby during pregnancy, we do talk about, keeping our core nice and strong. You want to have good strength in that pelvic floor musculature as well. So that is something we're going to address, going through some very basic, simple exercises you can do. Once you're really kind of more into that chronic phase, the inflammation has died down, that's when we really want to look at doing some strengthening stuff to eliminate this low back pain. Okay, so like I said, guys, we're addressing low back pain today. We're going to primarily be looking at the lumbar, the SI joint area, and we are going to do a few things to address our piriformis just to make sure that we really do complete the whole little bit of a chain here, not addressing just one area, but kind of addressing the things that do go right around it in terms of the hip relationship and how that pelvis is sitting with that sacrum, and then what's going on here at the lumbar spine. Again, this is stuff, guys, that if you're in that 72 hours, you know, the back pain just came on, it's pretty severe, there's a lot of inflammation, do me a favor, make sure you ice, rest. If you need to, take an anti-inflammatory, as long as it's not going to counter-interact with anything else that you're taking. So again, please check with your physician on that, or if you need to, call your pharmacist and double check there. All right, so guys, like I said, we're going to start with the soft tissue part first. So that's what we're going to address, and then from there, we're going to look at some nice, easy stretches that you can do to help your low back. And just remember, as always, if you're not sure where to get certain things that you see in the video, scroll down below. I've left links for you guys, so this way you can go ahead and get the tools that you need to stay pain-free. Okay, guys, so as I mentioned, we're talking about low back pain and starting to address why we would not just look at the low back, the lumbar spine, but also look at the SI joints, in case you are having a little bit of issue with what's known as sacroiliitis, and then also too taking a look at that piriformis muscle and making sure that it's not engaging, creating some sciatica nerve irritation as well. So like I said, the first thing we want to do is start with our foam roller. So, you know, when I do videos, I do like to use the full length roller, only because, not that I'm a very big individual, it's a little easier for us to manipulate our bodies on a longer foam roller than it is sometimes on the half rollers. And now, just so you know, it's up to you if you want to have a roller that has those nodules on it. It's all about the intensity. If you are somebody who does like a lot of soft tissue release work, it's all up about preference there. And also too, same with hollow rollers as well. So this is just your basic roller, nothing fancy, black, so it's got some density to it. But we're gonna go ahead and we're gonna first start with our low back. So come on down onto your roller, do sit onto the floor, because what we're gonna first do is we're gonna put the roller right here at the small of our back. Now I like resting my arms here just like so. Oh, and there's Cab, he's making a pass through. Anyway, so we're gonna put our elbows here, and what we're gonna do is we're gonna lift our butt up off the ground. Now, I should mention, if this feels like enough pressure, because maybe you're more in that acute stage, you may just wanna hang out here, and that's okay. So now, what we're gonna do is we're gonna lift our butt up, and if you want, again, keep the arms here, that's totally fine, or place the arms here over the chest. And all you're gonna do is just essentially just rocking up and down into that lumbar spine area. So right where that curvature is, you're just gonna go ahead and hit that. If you do lean into one side, you'll feel it a little bit more because you're starting to get really on that one paraspinal muscle. And then again, also too, trying to get in towards that QL. And again, you can do it on the other side. So now if I was to go ahead and come up a little higher where those dimples are, that's where you're gonna start feeling some of that more uncomfortableness, because that's getting into the SI joints themselves. And if they are inflamed, it's not gonna feel 100% great, but you're gonna start working out the tissue. Now you only need to really roll 10 times up, 10 times back, not really anymore, because then it just becomes a little redundant. So now what we wanna do is we wanna address the piriformis. So we're gonna go ahead, sit right up on top of the roller, cross the right leg over left, put the right hand on the floor, and lean into that side. Now, if your piriformis is really tight, you're gonna feel it the minute that you just kind of put pressure on that area. And again, just rocking up and down, you kind of wanna feel around for the area, and then you do wanna go ahead and switch sides. It's very important to always do both sides. Even if one side doesn't feel as problematic, it's really important to go ahead and address both. So like I said, when you're having low back discomfort, it's very important to do some soft tissue work to these areas. Now, when we do the soft tissue work, you will notice a little bit of increased inflammation. So do make sure you ice down the area afterwards. A good solid 20 minutes on the back should suffice. And like I said, if you think you need to take an anti-inflammatory, make sure you check with your primary care physician and pharmacist first to make sure it's not going to be counteractive with any other medications you're taking. Okay, so right there, there's the soft tissue. Now, what about some exercises? So a nice simple exercise that you can do to start resetting the hips and getting that core firing is to simply now lay on your back and put the foam roller in between the knees. So what we're going to do now, we're going to come down onto the ground, onto our floor. We're going to lay back, take the roller, place it in between our knees, and we're keeping our feet flat, hands at the floor, just relaxing the upper body, just hold and squeeze here, allowing for the body to really push down into the floor, starting to gauge the inner thigh here as well, resetting those hips, so this way you're starting to take that external rotation out of the hips, allowing for that core to really engage, allowing for those spinal stabilizers to also engage. And remember, those spinal stabilizers come off of the actual lumbar spine, they come off the facets, they come off the lamina, they come off all those other little bony structures that you can't see to the naked eye. Now, if this is feeling pretty comfortable after 30 seconds, no real pain or discomfort, you can go ahead and then bring the knees up to a 90-degree angle and hold and squeeze here. And again, as long as there's no pain and discomfort, you can proceed and go up a little further and hold the legs up here. Again, just squeezing the roller, allowing everything to reset. This is the first step that you would want to take in really kind of healing your back pain when it's initially kind of just out of that acute phase and you're starting to venture into that chronic phase, from there. So those three are the first steps that you would want to take when really working on strengthening your low back. Now, say you want to go a little step further. Now we can look at hyperextension. Now, the most basic hyperextension exercises you can do to strengthen your low back are going to be Superman's opposites and cobras, but not the type of cobra you're thinking about from yoga. So now, don't laugh too hard, but my flexibility is crap. So do bear in mind that I actually don't have the best lumbar flexibility, so you're not going to see me getting up off the floor really high when performing these exercises. So do ignore that little bit. So the first thing we're going to do is we're going to come down, we're going to lay flat onto the floor, placing our arms straight out in front of us, resting our head comfortably on the mat. Now from here, we're going to lift our arms and our legs up together, just like so. Now, if this is a real struggle for you, you could try just lifting the legs first, okay? Again, these are all the exercises you would do when you're really in the chronic phase to strengthen your back. So the first thing we're going to do is 20 Supermans, just like so. Then we're going to go to opposites. So what we would do is left arm, right leg, lifting up and down 20 times, and then we would switch to the other side. Okay, so that's what you would do there. Now here's the cobra. You're going to come, bring the arms in nice and tight to the body, but notice that I lift only the chest up and I'm really squeezing my butt on the way up. I'm coming up and down. I'm not lifting the hips off the floor like we would do in yoga. So right there, those are some just nice, easy strengthening exercises that you can do to help your back when it's feeling uncomfortable, discomfort, or like I said, you're in more of that chronic stage of pain. So, like I said, the first thing you would want to do, obviously, ice it down. Second thing you might want to look at is possibly taking an anti-inflammatory, because guess what? Life continues on, regardless if we're in pain, but do double check with your primary care physician and pharmacist to make sure it's not counteracting with anything else you're taking. Now, from there, you can start by doing some simple soft tissue work with a foam roller. I do recommend going easy at first, ease into it, and then definitely ice it down afterwards, because you will have created a little bit of inflammation because you are breaking down the tissue. Now, hydration will help a little bit too in making sure that inflammation gets pushed out of the system. Then from there, you can start with those basic holding exercises by putting the foam roller in between the knees, resetting those hips and allowing yourself to feel a little bit stronger by really exercising the spinal stabilizers along with your core. The final piece is to start by doing some actual back strengthening exercises. And if you've seen any of my videos, you know I always go with the basic movement first and then gradually add in some other stuff to advance it from there. Because guess what, guys? If we're having pain or discomfort with the most basic, we're not ready for that advanced move just yet. All right, so if you have any questions or comments, drop them down below. And if you want to get anything that you see in these videos, anything from the TRX or the foam roller, you'll see those links down below as well. Please do use them. And if you, all right, guys, like I said, this is Dr. Heather, and this was about fixing your back pain.